the bone joint organ and look at kind of the surface part of the joint. So looking at cell-based therapies for cartilage restoration. So looking at the basic science, articular cartilage is a very complex viscoelastic tissue. So with the different types of with the cell type that's in there, there's type 2 collagen, and then the actual structure is very difficult to recreate. So this certainly affects how we look at how to regenerate and or replace articular cartilage. We know that articular cartilage lesions are very common. About anytime over the age of 40, we'll have about 40% will have a full thickness defect that's found potentially incidentally. We know that 25% of athletes will have a chondral defect that may or may not be symptomatic. So then the question becomes, what do we do with these cartilage defects? We have to first identify if they're symptomatic, because we assume that these cartilage defects, once these occur, these will eventually progress and become osteoarthritis kind of down the road. So when we think about cartilage injury, the cartilage is in and of itself, as Dr. Lane had kind of mentioned, is aneural. It's also avascular, and so the intrinsic ability for cartilage to heal is very limited. So when you go with superficial to partial thickness defects, they don't really heal themselves. So then we look into when you go full thickness, then that's when you have the ability to get down to the bone marrow, get down to the cellular elements, and have a healing response. So when you think about this, we think about the kind of surgical options you can do to recreate cartilage, and this can be anywhere from reparative to regenerative to restorative. And so today I'll talk more about the reparative and regenerative aspects of cartilage. So we're going to take this into the tissue engineering realm. So when you think about how to create and recreate cartilage, you go back to the principles of tissue engineering for regeneration. You need to have a scaffold, which is kind of the structure that helps support the cells